Passivant and Shadyside rotations are a lot like private practice. They are our busiest rotations, I would say. Most first start blocks at those sites. So the mornings can be pretty busy. Like I was saying, it kind of gets you a feel for what private practice is like, because you show up, you pre-op these patients, you do their blocks, but the day usually ends pretty early, which is nice. Usually one person's on call, so they will help with the first start blocks, and then, you know, they will round on the patients, put the notes together, write all the notes for the patients, while everyone else at the site, you know, continues to do the rest of the blocks that need to be done. And then once most of the blocks are pretty much all done, there's only 1 or 2 left, most of the people go home for the day, and the call person will stay to finish up the last 2, finish up any notes, see any post-op patients that need to be. And then, you know, most of the time they're out of there anywhere between 1 and 3 p.m., just depending on the day. For the most part, you get the best experience, I think, at these places because you do the largest number of blocks. At Shadyside, you do mostly QL blocks, a lot of femoral blocks, a lot of erector spinae catheters and single shots. You do a couple upper extremity nerve blocks in the same day surgery, but mostly I would say it's those first blocks that I mentioned. At Passivant, I think, is probably our most complete site. You do pretty much a little bit of everything. So you do intrathecal morphines, so you get a lot of spinals there. You do a lot of upper extremity single shot nerve blocks as well as catheters. You do lower extremity single shot nerve blocks and catheters. You do QL blocks, you do erector spinae and paravertebral blocks. So I think Passivant's probably our most complete site. But, you know, overall, both of them are very busy. You get a lot of blocks and a lot of teaching from the attendings that are there. I think some of my favorite parts of the program is just, one, the overall experience you get. I think they do a good job of, you know, rotating us through different hospitals and places where you do a lot of blocks. So I'd say probably in 7 months of training so far, I've done probably close to 1,000 blocks or catheters. And I can tell you right now, just in 7 months, my regional skills have tremendously increased from what they were in residency. Just, you know, being able to do this, as well as, you know, rounding on the acute pain side. You get a lot of experience taking care of these patients perioperatively as far as the acute pain side goes. Another thing that I really like is the work-life balance. I'm sure there's a lot other fellowships out there, you know, that you could be working a lot harder, taking a lot harder call. It's nice because, you know, your call weeks are mostly you are at home with a pager, and if you get paged for a particular problem, you can call the nurse back or get on your computer and solve it with some orders from home, and you rarely have to come back in. You never have to do any overnight calls. Most of your days, yeah, we start early in the morning because, you know, you're doing those first start blocks. Most days end pretty early, so the work-life balance, I would say, is very good. I would say for the majority, you know, I probably work on a normal week, probably anywhere 30 to 40 hours a week. Maybe on a call week, 40 to 50 hours because you're staying there a little bit longer. I'd say everything runs pretty efficiently, so that the work-life balance is very good. And as well as, you know, if there's anything I wish I knew before I came here, honestly, I don't think so. I think they did a pretty good job, you know, kind of explaining on my interview day and talking with the fellows and the attendings what it was going to be like. So I kind of knew what I expected coming in and kind of how I expected.
Pediatrics is one of our best rotations, I think. First of all, you get an orientation, which you don't get for any other rotation, which is really nice because you get to see where everything is, get to see how the day runs and stuff like that. There's 2 roles typically. You're with the pediatric fellow. One's the blocker and one is the rounder. The blocker does pretty much all the blocks throughout the day, does the notes for those patients, and writes all the orders. The rounder will round on all patients that are inpatient, and also they'll set up the induction room, which we use sometimes to speed up the blocks and put patients to sleep before they go to the operating room. So you get to put patients to sleep and also do the airway if they need it, which is really nice too. We get some OR experience. The anatomy in pediatric patients is really, really good. So it's great to see that. You can see in real time what the anatomy looks like for all blocks. We do extremity blocks, truncal blocks, neuraxial blocks, caudal epidurals, pretty much any block you can think of we do in the pediatric world. You also get to do dosing of not only local anesthetics, but also opiates, adjuncts, and infusions of all of those things as well. So going to 10 different sites sounds pretty intimidating, but it's actually not that bad, and I think there are some benefits. We go to 10 different sites, but there are some private practice type run sites and some academic type run sites, so you get to kind of see a mix of all those things. Also some trauma thrown in there too. So no matter what your future holds, you get to see kind of everything and see what it's like to be in those different settings. We also get to learn from a ton of different attendings and see how their techniques are, different styles, different tips about things, which is really, really great. There's some sites that are more dedicated to extremity blocks, some sites that are dedicated to truncal blocks, some a mix of things. So you kind of get to see everything. We get ample amounts of blocks for ACGME accreditation, so there's no trouble there. It is kind of tough seeing the trying to find where everything is in each location, but there are guides online like crazy. You can find them very easily, and you can always ask your co-fellows, which makes it really, really easy too. But it's not too bad. Sounds intimidating, but it's not.
Being on call is something that is an ACGME requirement. We're on call 12 weeks a year, which, like I said, is one of our requirements. On average, that is about 1 week a month. Very rarely are you on call 2 weeks a month. It just depends on how many fellows are at each site. I don't think up to this point this year I've been on call 2 weeks in a row. It has happened, but not very frequently. When you're on call, you are responsible for either a phone or a pager for 24/7, a Monday to a Monday. It does allow you to either answer the phone or the pager pretty much overnight throughout the day. You do relatively fewer blocks than your colleagues when you're on call, just because you're managing patients on the floor. You manage patients that have catheters, any acute pain issue. Most sites we are a perioperative pain service, so that does limit us to just patients who are having surgery or who had surgery during that admission. I think being on call prepares you for when you're an attending in the future, so you can handle anything that comes up, whether it be an acute pain issue or an issue with a regional block or a catheter. Presby and Mercy are our two level 1 trauma centers that we cover. Mercy also has a burn center. I'll first talk about Mercy. It was one of my first rotations. It's a place that I hold near and dear since it was one of my first rotations. It is, like I said, a level 1 trauma center that has a burn center affiliated with it. We do a variety of blocks, anywhere from truncal blocks to extremity blocks, rib fracture patient blocks. It's one of our sites where we're not just a perioperative service, where we also do cover trauma patients, which is a unique experience that we get here being a level 1 trauma center at Mercy. I wouldn't trade that experience for anything else. Presby is another level 1 trauma center that we cover. It's also a large transplant center. It has provided me with experience doing nerve blocks for especially lung transplants, which is something I didn't have experience with before coming to fellowship. I do a lot of truncal blocks at Presby. In addition to the truncal blocks, you will do blocks for cardiac patients, which is a unique experience that I didn't have prior to coming here. And I think those two sites are a great addition to the UPMC rotation. I have really enjoyed getting to work with my co-fellows. It's not like residency where you kind of work alone. Being in this fellowship, you work with multiple co-fellows a day at almost every site besides 1 or 2. I think it's really wonderful to build a rapport or camaraderie with your co-fellows. It provides a really great social aspect for those of us that didn't do residency here or coming from other residencies. It's really nice to interact and work with your colleagues. I think the number of blocks that we get, we all meet our numbers relatively early on in the year. We don't compete with residents for blocks. It is a unique experience that we do get to do blocks on our own and then supervise residents once you're farther along in the fellowship. It's something that I've enjoyed.
So Mercy Hospital, as probably you know, it's actually a trauma center. It's actually a rotation. It's a busy rotation. Basically, not because of mostly outpatient procedures, but it's basically because it's like the referral center for burn patients. What that means is actually that you have a lot of different blocks to do because the patients come there with different sites that need to be blocked. So that presents a challenge and kind of like makes a force in your creativity. That's one of the good things because the surgeons kind of like know exactly what you're doing and they give you a lot of free range because the patients are kind of like very complex. So it's kind of like a really nice rotation to have there because it makes you think a lot. With Mercy Hospital, with this patient populations of IV drug user, you gotta be very well versatile with all these other medications that you would not use in a regular basis. What I mean is like methadone, Suboxone, and all these drugs become like a daily use. So you become very comfortable using them. So it's kind of like a really nice asset to build up in you. So for scholarly activities, as you may know, this is an ACGME accredited program. So
to do that, you have to follow some rules, and the program makes you have some QI projects, it's like quality improvement projects. For that, they basically tell you that come up with some ideas that can improve patient safety, or just basically like the regular life of the fellow or the residents. Just to like, actually it's kind of an important thing because it makes the program to improve year by year. So it's a nice thing to have. On the other hand, they can also tell you that you gotta do some report or some study regarding and try to get a publication just to be on board with the ACG. On the daily activities, we have an hour of lecture that we do like a week. Right now it's being virtual, but normally it's all together, which is kind of important because apart from knowledge, we get to see each other. Because the thing is that the program, everybody is in a different hospital, but it's nice to see everybody once a week. On the other hand, we have also a question of the day, more or less, that comes to your phone and you get the text message. It's kind of like a very answer question that you just multiple choice, and it's nice because it gives you like the answer at the time. So it's kind of a passive learning that you get in the background. The program allows some money that you can get that money for some of the books that you would like to buy, or even for your license. Kind of helps that money to be put in. Even though if I say license, also for the boards or for boards. So it's nice to have that cushion that it's important for you to build that library that you'd like to have at home.
A lot of things you can do in Pittsburgh. If you're a big foodie, there's a ton of different restaurants in different neighborhoods throughout the whole city. Some include in Lawrenceville, you'll have some up and coming restaurants as well as a ton of breweries. Those include 11th Hour Brewing, you have Arsenal if you're into ciders, you can also go to Gert's House over in Millville. And those are some of the nice restaurants you can have. If you're into the outdoors, there's a ton of parks throughout the city. You can go to Frick Park, you can do mountain biking. If you go to Shenley Park, you can do a lot of frisbee golf. Or if you go a little bit further outside the city in Ohio Pile, there's a ton of cross-country skiing. You can see falling water, or you can also do some hiking if you're into that. In terms of other aspects about the city, cost of living is pretty nice. You have that city feel, but depending on where you want to live, you can have a nice condo complex, or if you want to have a single family unit home, you can live a little bit further outside the city, all within an affordable range, depending on what you're looking for. In terms of the weather of Pittsburgh, it's very nice throughout the year. There's some cloudy days in the winter, but the snow accumulation is not terrible. I've gotten by with just a two-wheel car drive, and overall it's a very nice place to live. In terms of traffic, the one thing that a lot of people discuss is the bridges and tunnels. If you live inside the peninsula, it's not too bad, especially when the time we have to go into work. Super early in the morning, there's going to be no cars. But if you live outside in, say, South Side or somewhere outside the city, traffic can be bad, but it's usually just when you're going home. If you're into sports, we have the Steelers, or Steelers as they call it. We also have the Penguins or the Pirates. Pirates Stadium or the PNC Bank Park is very nice in the springtime or in the summer. Full skyline view of Pittsburgh, it's fantastic. I would highly recommend going there. The Jeopardy and ambulatory rotations are two separate rotations. For Jeopardy, you're essentially the extra person for the whole, all the different locations throughout the Pittsburgh UPMC regional locations. If there's a need or there's a high volume, we need an extra person, usually you'll find out the night before from the fellow chiefs, and they'll assign you to that location. And typically you'll go through most major sites, sometimes the ambulatory sites. In regards to the ambulatory rotation, that's more of a fast-paced surgery center kind of feeling. You will have the more private practice feel, you have to go quick, and it's in ambulatory settings, so you have to also think about your patients from a perspective of not being able to admit them post-operatively. And a lot of that is going to be orthopedic services and some podiatry, and it's actually a great purview into what ambulatory surgery is, which you probably did not experience during residency itself. Overall fantastic, and the whole goal of both of those rotations is education as well as getting a nice volume of blocks. If you need certain blocks, there's certain sites that do them, and you can just ask to go there if you really need them.